So in my previous video, I talked to you about what scoliosis is, and I even showed you what scoliosis looks like on a spine model. So in this video, I want to show you some pictures of scoliosis, some scoliosis pictures on x-rays, so you can actually visually see what it looks like on an x-ray. Helping you relieve pain, conquer stress, and supercharge your health the chiropractic way. Hi, my name is Dr. Walter Salubro. I'm a chiropractor in Vaughan. Welcome to this video. I'm going to show you a couple of x-ray pictures to show you what scoliosis looks like on an x-ray image. And if you're new to my channel, be sure to click on the red subscribe button so you get weekly updates, new content on how to relieve pain, conquer stress, and supercharge your health naturally and effectively. Now, remember, the spine should be straight. That's our normal model. When we look at it from the front or you look at it from the back, the spine should always be straight. I like to use the analogy of an arrow. So this is like an arrow, nice straight stick. That's the way the spine should be, right down the center. Now, if you look at these pictures here, there's two x-ray pictures of the spine. These are two different people. So the bottom picture here, this is an example of a scoliosis in the lower spine area, the lumbar spine. Now, before I talk about the pictures, remember there's two types of curvatures. There's an S-shaped type curvature, and then there's a C-shaped type curvature. The S-shape is more complex because there's a main curve plus a compensating curve. It's more complex to handle and help correct and manage. A C-shaped curve is less complicated and easily has a bit more chance of maintaining and also correcting. So here's a picture of the lower lumbar scoliosis curve. So if I put this reference line right down the center of the film, bisecting the sacrum as my benchmark area, you can see how the spine is laterally bending. So in this person's case, R represents the right side of the body. So this person has a right convex scoliosis. So that means that the lateral curve of this person's scoliosis is to the right. Interesting thing about this one, if you look closely, if you can tell in the picture, not only is the spine bending, not only is it bending like this, but it's also bending and rotating. So the actual vertebrae are bending and rotating, right? So remember we said in the previous video, and if you follow the card up here, you'll see that I have a video on scoliosis defined or how scoliosis is explained. Check that out. But a scoliosis is a three-dimensional deformity, which means that not only is the spine bending to the side, but there's also a rotation. So if you look at it from the top, it looks like the spine is spiraling. So this is a three-dimensional deformity, which can cause a tremendous amount of discomfort, stress on the joints, tension on the ligaments, tension on the nerves. Not only can it cause local pain, but if it progresses, in most cases it can without intervention, can eventually lead to organ system problems like heart complications if it's higher up in the rib cage, compress lungs, and just cause a whole bunch of organ system problems as well. Now this top picture here, this is more of a C-shaped lateral curve or scoliosis of the spine. Obviously this is a smaller individual, so is an infant or a child, and you can see that if I draw my reference point, that the spine is crooked to the side, and in this case it's more of a lateral curve and no rotation, so less complicated of a scoliosis to handle and help manage. So more of a C-shaped curve with no rotation. So there you have it. There's a couple of picture examples of what a scoliosis looks like on an x-ray. If you have scoliosis, I want to hear about it. Leave a comment below to tell me about your scoliosis experience and what you've done to help manage it. If you have any questions, leave it in the comments below. I do my best to answer questions. We do help people with scoliosis in our office with corrective care protocols for that. I will make another video about the corrective care protocols that we can help to at least stabilize the spine and scoliosis and possibly make some changes or improvements. And if you like this video, leave me some thumbs up. And don't forget to subscribe. Hit that red button below to subscribe. Hit that notification button. I will be sending out some more videos on scoliosis as well. Plus you get notifications of all my video tutorials coming up in the next few weeks. Thank you for watching. I'll see you in the next video. To learn more about how corrective chiropractic care at Back to Health Chiropractic Center can help you with your chronic pain problem, visit www.ibthcc.com. Back to Health Chiropractic Center is located at 20 Cranston Park Avenue, number 6, Vaughan, Ontario, L6A2W2.